Welcome to the KOOTENAY'S Medicine Talk. Today we're going to spend a little bit of time on neurodegenerative illness. Mostly in our dispensary that relates to Alzheimer's disease, Parkinson's, and MS, although there are others we can talk about in future episodes. So specifically, if we're looking for any evidence beyond our own experience with cannabis as being useful for these conditions, I'd like to show you a patent. This patent is owned by, guess who? The US federal government, yes. And they applied for this patent under Bill Clinton's tenure as president when they were arresting increasing numbers of people for marijuana possession. And guess what this is for? This patent was issued to the US federal government in 2003 for cannabinoids as antioxidants and as neuroprotectants. Specifically, this patent talks about the use of THC, CBD, and other cannabinoids to treat and prevent things like Alzheimer's and Parkinson's and MS. So getting away from outright corruption at the federal level, we know there's peer-reviewed scientific evidence that shows potential here. Now, cannabinoids are antioxidant compounds. They're also neuroprotectant compounds. So in Alzheimer's disease, when we see plaque accumulating around neurons and not leaving the brain as it should, cannabinoids tend to do a couple things. They get into the brain. They tend to, in studies, show brain cells coming back to near normal functioning when they're encased in Alzheimer's plaque. They also, it looks like, help clear plaque from the brain, specific to a study relating to CBD in, I believe, 2013 in mice. So we have some great indication there in Alzheimer's. Parkinson's as well. We're talking about tremors and gait and pain and any type of psychological, cognitive functioning issues. Well, cannabinoids, again, because they're antioxidants, because they're neuroprotectants, they're very useful. There's a theory out there with some evidence to it that as our bodies age, our immune systems start to become overactive and start to attack our tissue and impede our function as beings. If that's true, and it suggests that the science is showing there's something to this, then cannabinoids would be a perfect balance to an overactive immune system by providing homeostasis again, by putting it back into balance. When it comes to MS, we look at the immune system attacking the myelin sheath that encases neurons. Well, again, we can look at the effects of cannabinoids as providing balance and their immunomodulatory effects, that is, modulating immune effect, either up or down depending on what's required in that situation. And anecdotally, there is a large amount of evidence to show that cannabis and cannabinoids are very, very good for helping people with MS and related symptoms. So thank you for paying attention to this, and stay tuned. We're going to cover other neurodegenerative illnesses, and specifically, not just treating the symptoms of them, but the idea that was expressed in this patent, that there's the potential to use cannabis as a prophylactic against the onset in the future of these illnesses, is extremely interesting and very important. And that's what we're also looking to. Thanks for watching.